Welcome to How to Obtain Your Choice of Fellowship by Dr. Sanda Tan and Dr. Christiana Shaw. In creating this project, we surveyed different fellowship program directors, residents going through the process, and looked back upon our own experiences, previously as applicants and now on the selection committee. We asked questions about what program directors are looking for in an applicant and how they choose or rank applicants. Also included are tips on how to be successful on your interview day. The survey was sent to program directors of various fellowship programs. Responses were collected, and we found answers to be very similar. First and most importantly, you should think about your personal goals to determine what kind of fellowship you are looking for. You should reflect on personal values and priorities and be honest with what is acceptable to you. One way is to create a list of personal values and professional goals, ranking each. Then integrate the two lists. See what conflicts will arise and consider how you will manage them. Certain fellowships may be more conducive to accomplishing your personal and/or professional goals. A lot of preparation for a strong fellowship starts early and continues throughout residency. A strong application includes strong academics, including ABSITE scores consistently above the 20th percentile. Of course, higher scores are more desirable and necessary for more competitive programs. Completing a residency with a history of strong general surgical training is also important. Secondly, find mentors at your home institution or even from medical school. Declare an interest to your mentor as soon as you are seriously thinking about a specialty. It is usually helpful to find a faculty mentor in the specialty to which you are applying so that the mentor can help you set career goals, get to annual meetings, and meet people within the society, and maybe even create research opportunities for you. Sometimes your general surgery program director can help you find a faculty mentor. Try to have some publications over the course of residency, even if you did not have a dedicated research experience. Publications are essential if time was taken for research. The quantity of publications will often indicate your productivity. Even a few case reports or a review paper written during your clinical time will help your curriculum vitae. Spend some time writing your personal statement and have others critically review it. Try to make the statement interesting, but certainly not arrogant. This is one area where you can differentiate yourself from other applicants. This is a good place to show that you are truly passionate about the specialty to which you are applying. Letters of recommendation from people who know you personally and professionally are also important. Many residents ask about who they should obtain letters of recommendation from. Certainly include faculty who know you well and who can speak highly of you. Even if from junior faculty, a good letter will carry a lot of weight. Having a letter from a big name can't hurt either, but if he or she does not know you well, it won't necessarily help you. Be sure to ask your mentor's opinion on this. Have a good picture taken. Check for typographical errors, then have someone else check for you, and check again. And be sure to use a standardized CV format. You might be able to obtain one from your mentor, or you can download a template from the AAMC website. Have your mentor, program director, or chairman advise you on the content of your CV. Again, make sure to proofread. The number of interviews depends on the specialty. Some fellowships are hard to obtain, and even strong applicants should interview at many places. Other fellowships tend to have open slots, so you may not need to interview at as many locations. The strength of your application also plays a role. If you have a very strong application, you may not need to interview at all lower tier programs. Regardless of the strength of your application, however, always have a backup plan, including a few places that serve as second choice programs. Interviews can be expensive. Some residents take out a small loan to help offset expenses incurred during interviews for fellowship. Some banks will offer good rates for physicians, so be sure to ask around. Prior to signing up for all interview locations, make sure to check with your program director about leave allowed for interviews and national regulations. Always ensure adequate coverage of your clinical responsibilities and adequately sign out your patients to another resident before you leave. In order to prepare for the interview, search the internet for program and faculty information, especially strengths of the program and how their vision and mission will align with your career goals. Look up the publication lists of faculty members to understand their research interests. Certain research programs may be highlighted on the website as well. Have answers prepared for certain questions. A few common ones are, why have you chosen this specialty? Why are you interested in coming to interview at this program? How do you think you will fit in the program? It is good to have a case or two that is memorable to you. If you show passion as you discuss the case, it can demonstrate your excitement for the field. Prepare to discuss your research and be able to defend your data. You may need to explain your research to someone who is not familiar with your research topic, with someone who knows considerably more about it than you do, or with someone who has a different opinion on the subject. Finally, you should review your career goals and have realistic expectations. These may change over the time, but you should be able to support your current ideals. During the interview, be on time and be energetic. This can be hard after being up for call, managing services, and traveling. But remember, the interview is only for a few hours, so be energetic during that time. Smile and greet people. Be interesting, be passionate, and speak clearly. Have a plan for research, especially if research is a required part of your training. If research isn't built in, still have a clinical project you find interesting and may want to pursue. Have realistic goals for your career, and don't be afraid to discuss them during the interview. Do not appear arrogant. Remember that the faculty want to teach you something. You don't want to give a know-it-all first impression. You also want to portray yourself as a hard worker, so don't ask about time off or vacation early in the interview. Finally, please dress appropriately. No heavy cologne or perfume. Keep makeup reasonable, and suits should be well-fitting and not flashy. Programs are looking for someone with the following characteristics: someone who is trustworthy, dependable, hardworking, enthusiastic, a team player, and someone who will be academically productive. Fellows and attendings work very closely together, and fellows often have more freedom than residents to make decisions and to operate. Faculty want to find someone who they will get along with during fellowship, someone who they can trust with their patients. Faculty enjoy teaching fellows and often want them to become a lifelong mentee and friend. After the interview, promptly send thank you notes. Be careful, again, with typographical errors. Email notes are acceptable and often received faster than regular mail. A nice thing to include is a topic you discussed during the interview that was unique. Write down the pros and cons of each program immediately after you visit them, perhaps at the hotel or on the plane on the way home. After completing your interviews, talk with your mentors and discuss programs in your rank list. Don't be afraid to ask your mentor to make a phone call to your top institution. A phone call, especially one from someone in the specialty, carries substantially more weight than a letter. Fellowship is more of a match than medical school or residency. It's important to find a place where you really fit with the program, and vice versa. That being said, do not rank programs only by prestige. Certain programs may not be right for you. Other things to consider include, what are your career goals and research goals? How can each program help you achieve them? What are your family's, spouses, and/or significant others' needs and wants? Be honest with yourself and remember that fellowship is typically only 1 to 3 years. Geography may not be as important for such a short time. Trust your gut feelings about programs. But discuss your rank list with your mentor and your general surgery program director or chairman, as he or she might have additional insight into programs. If you do not match, the APDS website at apds.org may have information about programs that went unfilled or other fellowship opportunities. Ask your mentor, as there may be programs that exist outside of the match for your specialty, and some programs offer a year of research before entering the fellowship. Discuss your application with your program director. Reconsider the specialty and what you need to improve, or perhaps consider an alternative fellowship. Spend time in research or on other ways to improve your application. Study and pass the American Board of Surgery examinations. And become more involved with your respective society. And remember, if you don't match, you have completed a general surgery residency. This is something to be proud of. You may be able to create a practice that meets your goals without fellowship training. In conclusion, fellowship really is a match process. You need to find a program that fits your goals and objectives, just as they are looking for the right fellow for the program. Listen to advice from your mentors, general surgery program director, and department chair, as they have been on both sides of the process. Be honest with yourself about your personal and professional goals and what it takes to achieve them. And finally, be happy with your choice. Of course, if it's not right, you can always change your mind. Good luck!